Hello Pilates family, it's me and the lovely Annie Benny again. We're looking at an exercise called knee drop. I always call them one of God's exercises, the exercise of the universe. Exercises that I feel can be suitable for many different people. This is a knee drop, and those of you who've done any training with me will know that I love the knee drop. Let's look at somebody with sciatica. So many of us might be giving people exercises like the Clam, lying on the side, and there's a lot of controversy, is that the way you say it? Controversy for that one. There's a lot of debate as to whether the Clam is good for disc issues. So we're going to look at an alternative. The alternative being knee drop. So if you have somebody who's got bursitis who can't lay on the side, this is a great exercise. If you have somebody with sciatic issues and you're not sure whether they should do the Clam or not, have they got sciatica from a disc problem? Have they got sciatica because they've got piriformis syndrome? And in that case, the Clam would maybe not be appropriate. So let's have a look at the knee drop. Okay, I'm going to shut my gob and get on with it. So I'm going to get Amy to put her hands on her hip bone so she can get feedback for herself. Relax the shoulders, relax the jaw. I'm going to get Anya to bring the ankles and the knees right together. So folks, if somebody's had a recent hip replacement, how would you adapt this exercise? Take the knees an inch apart, ankles an inch apart. Yep, okay. So I'm going to get Anya to focus on her sacrum, thinking about keeping the hip to ribs in the same position, keeping the sacrum still. She's going to lower her knee, and I know that it's not the best camera shot, but we tried doing it from an aerial view and it were a bit rude. So she's going to go as low as she can without moving her sacrum and bring it back into centre, changing legs. So I'm focusing on this right knee, right hip, sacrum staying really still as she lowers the leg. Stop about there and bring it back. So I'm going to get Anya to carry on doing that movement. Folks, when I focus on this with a client or a group, I work on keeping the sacrum still. So you've noticed that I've not got it to get a connection into abdominals. I'm just asking her to think where the ribs are, the hip bones stay in the same position. And I'm getting Anya to focus on her sacrum staying still, so that she is bringing about the movement pattern that I want without me having to get Anya to consciously switch on here before she moves. I want it to start to be more of an automatic rather than her having to think about it. However, Anya's pretty good at this. So if you've got a client that's not as effective at first, you may want to cue a little bit more around here. So this is great for pelvic stability and core stability. It's also fantastic if people have sacroiliac joint issues, but only going as far as they are pain-free, trying to balance and work equal both sides. Very often you'll get one side that's not as effective as the other. You just breathe in subconsciously, or I'm going to get Anya to breathe out as she lowers. So when you breathe out as you lower now, just soft breath out and a soft breath in. I'm going to keep doing that movement. If it causes any pain around the pelvis, then you can reduce the range of movement. You only go as far as you can, keeping the knee, the hip and the sacrum still. So it's a great exercise for pelvic and core stability. It's a fantastic exercise for prenatal, as long as you are not keeping them on the back after specific weeks of pregnancy, looking about 16-ish weeks of pregnancy. It's also great for postnatal, as long as it is not increasing any symptoms of pelvic girdle pain. Brilliant alternative to the Clam if you are unsure whether the Clam is suitable for your client or not. I love this exercise. We've got one more on the right, please, Annie. One more on the left. It's not the leg that's moving that's doing the work, folks. It's the leg that's still, that's in that closed chain position. Have a rest. So it's the leg that's still that is doing the work.